Today we will discuss the methods and rationale of wound bed preparation. As defined by Tutora in 2012, wound bed preparation is the process of removing local barriers which may facilitate healing and provide a more efficient means of wound management. These barriers may include necrotic tissue, bacterial imbalance, or excessive amounts of exudate. The importance of wound bed preparation has been widely documented, and as mentioned by Davis et al. In 2006, advanced wound therapies are more effective in an optimally prepared wound bed. In our presentation today, we aim to outline key strategies such as time, which are employed to overcome the barriers present in chronic wounds, and also act to promote an environment suitable for healing, as well as discussing debridement and other cleansing methods. And finally, we will conclude with an overview of our main findings.
When it comes to the management of a wound bed, it is important to consider the mnemonic time. These principles influence the method and rationale by which a wound is addressed, as they illustrate a simple link between clinical observations and underlying cellular abnormalities. T, tissue, includes assessing the integrity and viability of the skin. Is the tissue non-viable or deficient? Things to look for include slough or necrosis, as these can delay wound healing by prolonging the inflammatory phase when they induce infection. Devitalized necrotic tissue impedes reepithelialization, as it mechanically obstructs contraction. It also masks underlying fluid collections or other abnormal tissues, which may influence the adequacy of wound depth assessment. Thus, to promote healing and reduce the risk of local infection, it is important that when non-viable or deficient tissue is present, debridement techniques should be implemented in the wound bed preparation. These techniques will later be further discussed. The next letter in the mnemonic is I, indicating towards the presence of infection and/or inflammation. Clinical signs and symptoms, including odour, erythema, and the presence of exudate, need to be assessed, while the underlying problem of infection caused by high levels of bacteria must be acknowledged. Techniques including debridement, the use of antimicrobials, and anti-inflammatories are useful in preparation of the wound bed. Third of the mnemonic is M, necessary for restoring the moisture balance of the wound. Assessing the signs and symptoms indicate desiccation or excess fluid. This aspect of the wound is more so recognized during the wound dressing stages of wound management by interventions of the use of appropriate dressings, compression therapy, and vacuum-assisted closure. Lastly, of the mnemonic E, representing the edge of the wound, is the wound's edge non-advancing or undermining. Interventions for when an abnormal epidermal margin or granulation tissue is present include the reassessment of the patient and wound for advanced therapies to be considered.
Wound cleansing involves the application of a non-toxic fluid to aid the removal of debris, wound exudate, and metabolic waste from the wound, all of which in too much abundance can negatively affect healing. By doing so, we are able to create an optimal wound healing environment. Primarily, the main methods of cleansing are carried out using irrigation or showering of the wounds. Tap water is often the cleansing agent of choice in the community or in hospitals, as it is easily accessible, efficient, and cost-effective. However, Fernandez and Griffiths indicate tap water is unsuitable for exposed wounds, for example, wounds with exposed tendon or bone, whereby normal saline solution is recommended. Sterile saline solution is the favoured wound cleanser by practitioners because it is an isotonic solution that does not interrupt the healing process. However, it is more expensive than tap water, which costs $1.16, compared to normal sterile saline, which costs $1.43. Antiseptic solutions are disinfectants that reduce the number of normal skin flora as well as pathogenic contaminants. Antiseptics are non-selective solutions and they can be toxic to the host tissues as well as pathogens, therefore having the potential to delay wound healing. There is an ongoing debate as to what is the optimum cleansing agent. A study by Wise looked to determine if there was a significant difference of the rates of infection in wounds cleansed with normal sterile saline compared to wounds cleansed with tap water. The results showed that 6.4% of wounds in the saline group were infected compared to only 3.5% in the tap water group. The study concluded that there was no difference in infection rates of wounds cleansed with either saline or tap water. However, a clinical trend towards fewer infections in the tap water group was identified, suggesting it is a safer and more economic cleansing agent than saline. Furthermore, a study by Fernandez and Griffiths assessed the effects of water for wound cleansing compared to other cleansing agents. They found there was no significant difference in infection rates in wounds that were cleansed with tap water compared to wounds cleansed with saline solution. Antiseptic solutions are antimicrobial solutions that can kill, inhibit, or reduce the number of microorganisms and are thought to be important in wound infection control. Few scientific studies have been carried out on this method. Antiseptic solutions must be concentrated to have their desired short-term effect on open wounds. An ideal antiseptic has the following qualities: a broad spectrum of activity, low potential for resistance, a rapid activity, it must be non-irritating, effective in the presence of cellular debris, and most important, they must be non-toxic. Controversy still surrounds the use of antiseptic agents. However, Smith found povidone iodine poses no significant hazard to wound healing. This is therefore perhaps the most effective antiseptic solution that may be used for cleansing. Cleansing of the wound is still an important practice of wound bed preparation, as it is an important step in helping to prevent wound infection by decreasing the bacterial inoculum to levels that can be managed by host defences. However, it appears there is no clear consensus of opinion as to which cleansing agent is best. The cleansing of chronic wounds to remove foreign matter, necrotic tissue, or bacteria is usually either with normal saline solution or tap water. Ultimately, the decision comes down to the experience and opinion of the podiatric practitioner when assessing the wound which cleansing agent would be most appropriate.
Anderson states that the process of wound debridement is essential in effective wound healing and care. Dead or foreign material such as necrosis, eschar or sloughy tissue can be a breeding area for bacteria and a portal of entry for infection. There are several different methods used podiatrically to promote the optimal environment for healing through the removal of non-viable tissue from the wound bed. These include autolytic, sharp, biological and hydrosurgical. Autolytic debridement occurs naturally in all wounds to varying degrees as the body releases certain mediators to facilitate a moist environment. The technique involves the use of dressings such as hydrogels, which are made up of hydrophilic polymers within a dimensional matrix, thus creating a moist wound bed. The dressings can be occlusive or semi-occlusive and should maintain the natural moisture of healthy wound healing to soften the eschar. This type of debridement is very selective and causes little damage to the surrounding tissues, but is not as rapid as other forms and must be monitored closely to prevent infection. Sharp or surgical debridement is the physical removal of necrotic and sloughy tissue using a scalpel or other sharp surgical instrument and is the fastest debridement method. It is very effective but may be painful for certain patients and can be done under anaesthetic. Individual skill of the clinician is a vital element in how effective the treatment plan will be. There are several factors to be taken into consideration before having the patient undergo surgical debridement, such as understanding their medical history, if there's any vascular impairment or if the patient is on immunosuppressant medications, etc. Enzymatic debridement is much less invasive and uses topical enzymes to aid in the removal of dead cells by digestion. Some enzymes target devitalized tissues and others break down all types of tissue, so care must be taken when selecting and applying certain products. Biological or biosurgery debridement is a method involving the use of larvae. Larvae are live biological products which excrete proteolytic enzymes and antibacterial substances and feed on necrotic tissue. They have no interest in healthy tissue, therefore making them very safe to use and can be supplied in biofoam bags or free range. There can be an issue with patient compliance as this particular treatment plan can be deemed unsanitary. Finally, hydrosurgical is another form of surgical debridement and is a high-pressure saline jet used as a scalpel and removes sloughy and necrotic tissue. Anderson explains this form of debridement is licensed to be used in and out of the theatre and reduces the need for surgeon involvement. The unit is very expensive and the handpieces are single-use, so recurring cost is necessary, but compared with the cost of surgical debridement, it can work out cheaper in the long run. This treatment type also has the same implications as surgical intervention for patients with vascular impairment or on immunosuppressant medications.
In conclusion, wound bed preparation is beneficial to the wound healing and makes for more efficient management of wounds. The process involves assessing the wound, debriding, cleaning, and applying antimicrobial, hydrogel, or enzymatic agents if necessary before the wound is ready for dressing to be applied. Assessing the wound, we've gone over the systematic approach of time, which is the mnemonic, assessing the tissue integrity or viability, the inflammation or signs of infection, moisture balance, and the edge of the wound. The cleansing process was the removal of superficial debris, exudates, the metabolic waste or bacteria. We've also discussed the use of tap water, saline solutions, or antiseptic solutions or topical preparations, with the aim to reduce the risk of infection and aid healing. Also mentioned the tap water versus saline, where there's no difference of infection rates, and that a safe antiseptic to use would be povidone iodine. The debridement is the removal of the dead or foreign material and bacteria to optimize wound healing, and we've discussed the options of autolytic, sharps, surgical, biological, or hydrosurgical. Thanks for listening to our preparation.